Turning our attention now to homelessness. As this human tragedy continues to surge across the country, the Biden administration announcing more than $300 million in grants and vouchers for communities to tackle the problem. Earlier today, I spoke with Michele Steeb, a national leader on the homelessness epidemic and senior fellow at the Texas Public Policy Foundation, for her analysis. Michele Steeb, welcome to our show. Thanks so much for joining us.
Thanks for having me, Steph.
Now, the Department of Housing and Urban Development announced Thursday that it's awarding $315 million in grants and vouchers to address homelessness. That comes as part of a larger plan that they announced at the end of last year. What's your impression of how this plan is going so far?
Well, all of their plans are based on an approach to homelessness called Housing First, which they rolled out in 2013, saying that it would end homelessness in a decade. So we're now a decade beyond that promise, and homelessness has increased very significantly. Despite their promise, it's increased by 20.5% at the unsheltered level across the country and by 16% overall. California also doubled down on Housing First in 2016, and unsheltered homelessness went up by over 47% and by almost 40% overall. So their new plans and the new funding, as much as I wish I could say that it's going to work and it's going to make an impact, it's only going to produce more of the same.
Why is that?
Well, the data proves this out. So at the federal level, when they rolled out Housing First, one of the things that they did that they don't talk about is that they wholly defunded treatment, like drug and alcohol counseling, mental health counseling, trauma-informed care. They defunded those services completely, and they rolled all of that money into housing subsidies. And the results are that homelessness went up, again, both at the federal level and in California. So the real answer is we cannot solve this problem, which is a human being problem. It is not a housing problem. It's human beings who are struggling with very severe illnesses, diseases, largely mental illness and substance abuse, and they need treatment of those services. Housing is an after thought of that. You need to treat these illnesses first.
As you mentioned, addiction often accompanies homelessness, and there are many so-called safe injection sites set up to try to help with that. What's your take on these sites?
Vancouver is North America's first safe injection site. I don't even like to use that language because there's nothing safe about injecting illegal drugs. Since it opened in 2003, less than 1% of the site visitors have entered into any form of drug treatment. They will cite the fact that they've prevented overdoses. They haven't had an overdose on site, but they don't talk about the fact that in that area, in Vancouver, British Columbia, the illicit drug deaths have gone up by 900% since the opening of the safe injection sites. There's crime, there's congregations of dealers everywhere around that site because they have a built-in marketplace.
You've said that disease reversal services would better serve the community. What would that look like to you?
We need to increase treatment beds. We need to increase services. And at the federal level, for the vast majority of the homeless who are struggling with addiction, we need to fund those services and couple them with housing.
And lastly, is there anything that's being left out of the conversation about how to effectively address the nation's homelessness crisis?
I think what's being left out of the conversation, I know what's being left out of the conversation, is the data that proves that this Housing First approach as a one-size-fits-all does not work. They will say it's evidence-based, but the evidence is very clear. The evidence since Housing First has been in place is that homelessness has only increased. The other evidence that I would cite, in the Biden administration's new plan, they said that we need to double spending. Well, under Housing First, we already doubled spending and we got an increase in homelessness. So doubling down on a failed policy, doubling down on the investment in it will not work. And that is really what needs to be talked about at the federal level and everywhere else in the country.
Great. Thank you so much. Michele Steeb, Senior Fellow at the Texas Public Policy Foundation. Really appreciate your time.
Thank you.